A case of polio has resurfaced in the United States and has also been detected in New York's wastewater system. Tonight, a pair of experts share their thoughts on what this means and who could be impacted the most. KPIX5's Andrea Nakano has that story.
At least here in the U.S., there's been a belief that polio has been eradicated. But what this case shows is that some of these diseases are just one plane ride away from becoming a problem.
I saw 1,000 cases clinically easily.
UCSF epidemiologist Dr. George Rutherford worked at the CDC in the early 1980s when Taiwan experienced its polio outbreak.
You're seeing paralysis, and it's patchy paralysis.
Now polio has resurfaced in New York, where a patient is experiencing paralysis. Epidemiologists believe that patient came in contact with the virus overseas after visiting a country that still uses a weakened live virus in its vaccine, which then mutated. Dr. Rutherford says improved science is helping to detect these diseases in its early stages.
The technology has gotten out, is gotten way out in front. And also, I think there's also, a lot of caution because of COVID. People don't want to make the same mistake twice.
In the U.S., most people are already vaccinated for polio, so the concern for an outbreak is fairly low.
What I am worried about are pockets of unvaccinated communities, even in California and in the Bay Area. So if people are not vaccinated, they could be at risk.
This is coming at a time where overall vaccine confidence saw a dip and some kids missed getting their usual vaccinations during the pandemic.
If you look at the doses that were missed based on 2020 and 2021 data, we think that about 14 or 15 million children have not been caught up to date in the whole country.
Doctors estimate overall roughly 30,000 lives are saved every year in the U.S. from deaths due to diseases that are now preventable with vaccines. They hope the resurfacing of polio will encourage parents to get their kids caught up on all their shots.
They don't want to regret later and say, I wish I had done this. So when I was a young pediatrician, I would see a lot of these diseases every single week. We just don't see them anymore because kids are protected. So we want to keep those kids safe.
Andrea Nakano, KPIX5.